Your host, Marie-Therese Bolden, and I've got my resident doctor here, Dr. Euahna Varigos. And we had a really, really interesting chat about pain management and the efficacy and treatment of laser light acupuncture in pre-operative patients. And you've blown my mind away with the information you've given me. Here you are, an anaesthetist and a very, respected doctor, science-based, but you're looking at an individual as an all-encompassing individual. You're not just looking through the lens of science.
I'm not in my tunnel
You're
anymore.
not. And
I was in the tunnel for a little bit when I was giving anesthetics because I had to be.
Yeah, that's fine. Because, and you wouldn't be who you are today without it, right?
No, that's right.
But this is what I was saying. Like now I'm offering the coaching and mentoring to clients. And I was saying that each individual is so unique and there is no one size fits all. But if I don't look at you as a whole individual that is a mind, a body, a soul, and a spirit, and attend to all of those, you'll be out of sync. And generally when people are lacking enthusiasm, lacking energy, they're just getting by in life. One of those, if not multiple of those, are out of sync. And
sometimes you just need one little thing to
yes,
pop them
recalibrate.
Up. That's
to
right.
recalibrate.
So
exactly.
I have a lot of patients over the years that would never be able to meditate or do anything. Oh no, I've tried, can't do that. I'd treat them a few times and then they would be able to meditate.
Yes.
Little things like that. So it's almost like you've actually just
gone in, and you've gone in a different way.
Yeah,
too.
and you've also, I think, when you have acupuncture, you actually, people who have not experienced relaxation will actually experience it and understand and feel it, whereas it's not being natural for them.
Yes.
So I think that has had something to do with it.
Yeah.
And make decisions. I know people have made decisions after a course of acupuncture. And also I think that's why, and I've also dealt a lot with diet. When an integrative became sort of involved with integrative medicine when I started treating patients with acupuncture, because I was introduced to GPs who back in the 90s were interested in it early.
Yeah.
So I had that. I've got that background as well. Not that I have major in that now, but I will suggest it for patients.
Yeah.
And the other thing is that, yes, it is slow, but I am, in fact, in May. Did I tell you that I'm
going to France?
I'm going to France to give. I've given 2 Zoom workshops now over the last couple of years, and so he's a physicist, in charge of the European Medical and Mediterranean Laser Association. He's a physicist,
That's amazing.
A quantum physicist.
Amazing.
So he's a quantum physicist.
Amazing. That is amazing.
I met him in 2014, and he started this, and we, Anyway, he's intrigued by all this, and so he has started the first in the world diploma of PBM in the University of Montpellier, in the Department of Medicine or Health.
So that's photobiomodulation.
Right. And it's the first. It's the only place you can get a diploma in the world.
That's amazing.
And it's France.
That's amazing.
Not England, not America, where we're using this. So it's interesting, France.
That's great.
Yeah, it's great. So I'm going. He's been wanting me to be in person doing a workshop. So I'll be going end of May.
Fantastic. So there'll be loads of more information for you to debrief and for us to chat about. But like I said, I've had your treatment. I know that it works, and I know that it works. And even though I am somebody who is very open-minded and open to the adjunct treatments that are out there, and I'm someone that hasn't really taken medication until recently when I was suffering with the symptoms of depression and anxiety through the menopause, I'm always looking for an add-on treatment. I was always looking for an alternative way instead of taking the drugs. The drugs should be the last thing that we look at,
Absolutely.
And I know that your treatment works because the first time I came to you, I literally walked out of there and you said you're probably going to go home and want to sleep. And I did. And it was just like a release of energy. And then 3 treatments in, I stopped the hot flushes. I could sleep through the night. So I know that it's worked, and I could only imagine the efficacy it would have on pre-operative.
Yes, because
patients.
it's an easier thing to observe and experience.
Yeah.
It's easier to qualify,
right,
and quantitate what's happening. And
in pre-operative,
in pre and post-op,
instead of menopausal. And is that because you're not working on the endocrine system?
No, it's because the symptoms are menopause symptoms are dependent on lots of different things.
Right.
Swelling is easy to see,
right.
easy to measure.
Right. So it's
and
more
it's
acute.
an acute thing.
Right. Yeah.
Yeah. I'm saying that, if it's acute, it's always easier to show a change. If it's chronic, and menopause is a chronic thing.
It is. Yeah.
Then it's harder to get a change, but also it's harder to cement a change.
Right. Right.
So yeah.
Watch this space. I mean, I just think your treatment's amazing, and I think if it can, I can't imagine, God forbid, I can't imagine having to live with chronic pain. But I know there's millions of people out there that have to live with debilitating pain, whether it's from an injury or whatever it might be. This is something that we should look more into. This is something that we should try, because I know that it works.
And it is, because I know our hospitals are aiming to, we call it enhanced recovery after surgery. I go to my anaesthetic meetings, enhanced recovery after surgery,
right.
multimodal therapy, and it's all multimodal drug, let me tell you.
Right.
Although sometimes there is this idea that they're doing mindfulness before surgery, which is great.
So see, we are advancing.
Yes, but they won't do any medical acupuncture research.
That's amazing. It's a damn shame.
So there is an obstruction in the ivory towers. That's all I'll say.
Okay.
That against medical acupuncture or laser acupuncture, which is interesting.
Right.
But mindfulness, and I thought that's great, fantastic.
Yes.
Let's do laser acupuncture.
Yes.
So it's still a bit of a battle, but we won't go into that.
No.
The
positive is that I know it works, and so if I know it's worked for me, I will endorse it.
And the positive is I have surgeons who want me to help with their patients, and one surgeon in particular says to the patient, "Look, I don't know how it works. All I know is
that it works.
It's working."
Yes.
And 3 out of 4 patients who have severe nerve pain in their feet after surgery get better, and it's a really difficult thing to treat.
Well, Euahna, it was my gynecologist that referred me to you. She said HRT, I said no, obviously because mum's history with breast cancer. And she said, I do know of a specialist anaesthetist who specialises in treating menopause with laser acupuncture. I said, yep, let's get, and I ended up in your office. So there is a mindset, a medical mindset, or a scientific
there are little
that are moving.
There are little pockets.
Yeah,
there are pockets.
Yeah.
So
that are open.
And so basically, I know the surgeons who are not open, who are
receptive.
Not even just receptive, who actually know that what I do can help, and will allow me to help you in the perioperative period. Yeah. There are some surgeons who just can't cope, and that's fine. Yeah. But
different strokes for different folks.
That's right.
Yeah.
But as I said, I have a group of surgeons that I work with, and in fact, I can't work with everyone.
I wish you could.
until I start training.
Yeah.
And I'm waiting to find the anaesthetist who, like me, didn't want to be in theatre.
Yeah.
And wanted to have not the early starts, which anesthesia is, and then the late finishes. Wanted to have a more organised time for themselves to work by. Yeah. But still be productive. And I think the other thing with anaesthetists, that we don't have an extended career compared to a lot of other practitioners, because theatre is incredibly stressful and very full on. So anaesthetists tend to
wear out.
Well, they do burn out.
Yeah, yeah.
And when they do go, but they've got a wealth of experience.
Of course.
And we are losing that.
Yes.
And we need to keep them in some sort of area. And this is a perfect area, perioperative, in my opinion.
Right.
Perfect area for an anaesthetist who's decided, look, I've had enough. And I don't know whether I should say this, but basically they earn a lot of money now. And I do not, when I was doing anaesthetics, we didn't, let me tell you. And it was very stressful. I thought, why am I doing this? But they earn a lot of money and they deserve it.
Of course.
And so they earn a lot of money, but then they don't have to work as long, but they have a wealth of experience and knowledge and understanding about patients pre and post-op.
Right.
And this would be an area. I see this as the area that they can now continue for another maybe 5-10 years working, not as heavily, not as the hours are better, but be productive to the cause, basically.
Yeah.
Yeah.
Of course, I had the treatment for menopause. I had your laser light acupuncture for menopause, and I saw after 3 treatments, I had no hot flushes. I could sleep through the night. I didn't have as much anxiety. So I know that your treatment works, but in the way that you've described that prevention is better than a cure, and the reasons that your treatment works better on perioperative patients, it's because you're treating acute symptoms. Is that correct?
It's easier to see. I'm just saying it's easier to see changes and for patients to see a change as I'm treating them.
Right. As opposed to someone with menopause.
Yes. So you felt tired, and then over a period of time things changed and then up and down a little bit often. But with respect to the acute, for example, yesterday when I treated several patients, and I didn't see them pre-op. I saw one lady pre-op, but most of the patients I saw yesterday were post-op. And one had been in for a while with a knee problem and couldn't bend his knee. I treated him, and the physio knew. She said, "Oh no, you treat first, Euahna," because she understands what I do. Because afterwards she took him down the corridor, and he said, "It's so different. I can walk. I can bend my knee."
Oh, wow.
There was and what happens is they get a diuresis.
What is that?
That is, they pass a lot of urine. Because remember what I said?
You did say that. You said that
the fluid goes somewhere.
Yeah.
So where does it go? Normally we don't notice it.
No. So let's go back here. So when you're talking about fluid, you're talking about the lymphatic system.
I'm talking about the lymphatic system is a very delicate system.
Right.
And it hasn't got a pump like the heart, but it takes fluid from around our body, around our organs, and around our cells that are damaged all the time. Takes the fluid up, little worms. It's actually quite revolting, but they're little worms, that worm-like things that go push, 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 push up against gravity through the whole thorax and back and limbs and the left arm, and it collects in this very big duct on the left and from the head. And the right is just the arm. The left is the main one. And that's why people will know who come to me that I treat that area a lot.
Yes.
Because I'm trying to encourage the movement of fluid here out of the duct, right? This fluid.
Yeah.
Because then you can bring fluid up. Makes sense? Upstream.
Right.
So, but there is, the lymphatics are very delicate, and that's why they're easily damaged with injury, surgery,
cancer.
Whatever.
I think I've told you this before. I noticed when Mum got metastatic breast cancer, they couldn't find a vein in her body because her lymphatic wasn't working, and she swelled up like a balloon.
Yeah.
So much so that her skin started to break and chafe because it was just stretching. It was like someone had literally blown her up. And that's all because the lymphatic system is not working.
That's right. And it is crucial to our health, really.
And so what you're saying is that, generally speaking, we tend to overlook that, or it's not focused on.
It's not focused on in Western medicine or conventional medicine. And as I said, it has always been part of an ancient idea of one's health.
Ayurvedic.
But then, of course, they did think about the mind, the body, that was what they thought about.
Right.
But we're coming back to it a bit now, but there was a
definitely.
time where, nothing to do with what you're happening about you. It's all about chemicals and how we're going to treat your body. That's basically. So I'm just saying the one thing that we haven't quite got back to understanding is not understanding or thinking about is the lymphatic system, in my opinion. And I see photobiomodulation, light, as being, because I did mention about the cells.
Yes,
so
yes.
if you've got lymphatic cells, which are very delicate, they do not need much of my red light to help them. And that's what I'm doing.
Right. And our body is made up of light and cells. As much as a lot of people would like to think that our body is dense matter, it's actually the opposite. It's energy, and energy is light, correct?
Well, it is. Light is a form of energy.
Exactly.
I think also there are thought to be our own biophotons, so our own photons that are emitted to a certain extent by cell chemical activity in our body. But that is some people don't believe in that, and it's not sort of fact yet. But I think there is probably going to be something like that happen, that we actually have our own photons. But not a lot. So that's why when we add my light, we're sort of like, giving a boost.
Right.
Yes. And anyway, that's sort of a bit esoteric, that comment. But getting back to the lymphatics, yes, and they don't need a lot of energy. That's why I don't use how can I say, I use more of an LED rather than a laser when I treat the lymphatics.
Okay. Yeah, and you have used that on me as well.
That's right. And because patients do feel better after they've had a lymphatic treatment.
Yeah.
And I've got patients, who feel that when there are UV places now, you can do lots of things, and you do feel better. I suppose the difference with what I'm doing is I'm targeting areas, contact on the skin, so I'm targeting a specific effect rather than just this general idea of making me feel better.
Right.
Which is what the sun does too.
Yes.
Right?
And
we don't absorb.
Yeah, you did explain it. So specifically, say for example, someone's got a knee injury, your treatment pre-operative would be focusing on that specific area, the nervous system, the cells in that area, correct? Because just for those who are just tuned into this episode, how is it that your treatment laser light would alleviate protracted symptoms of pain? And
is this an injury or arthritis needing
well, either or? Give me
either or.
Yeah. So let's say it's arthritic pain, because there are a lot of arthritis sufferers out there who want help with this.
So that to avoid having a knee replacement.
Yeah.
Yes. I get a lot of patients who say, I don't want to have a knee replacement yet, but I've got a lot of arthritis.
Right.
But with the arthritic issue that you've got, you actually have a lot of inflammation around the knee as well.
Right.
And light photons have a strong anti-inflammatory effect, which I didn't sort of go into before.
Yes.
But it is an anti-inflammatory effect, an anti-swelling, reducing swelling, anti-inflammatory, and analgesia.
Right.
So they're the three things that I've got to sort out. What's the main thing I need to do for this patient? The other thing is to diagnose whether they have an added nerve issue, which is, I mentioned, that surgeon, the foot surgeon who sends me patients with nerve issues.
Right.
Because I don't touch that side. Because the patients will come in and say, oh no, it's so sore, it's sensitive, I can't touch it, it's swollen, it's red. So I'm not going to touch that side. I treat the contralateral side. So a lot of my treatment is contralateral, which is on the other
opposite side. And how does that work?
Well,
Explain
that works. That's an interesting thing because the lymphatics are governed by what we call the autonomic nervous system.
Right. Okay. So that's how it's all related.
So the autonomic nervous system, automatic, because you don't have to think, please, lymphatics work, I've got swollen.
Yes,
no.
yes.
It's like the autonomic nervous system is automatic, does all the things that we don't think about. For example, our gut. We've eaten today. Did we have to think, please send my digestive enzymes into my gut? Peristalsis, get my gut, my intestines and my stomach moving. We don't do that. Happens automatically.
Right.
The other thing that happens automatically is sweating. You don't have to say, I'm hot sweat, do you?
No.
You don't have to say, I'm lying down with very relaxed, I'm standing up. Please constrict all my superficial blood vessels so I don't faint.
Right.
Otherwise, all the blood will just go to the bottom, go to your legs because you're of gravity.
Right.
Right? So there'll be nothing to pump to the brain. So you don't think that.
Right.
Happens automatically.
Right.
Hot and cold. So if you're cold, we don't think hair, stand on end to protect me with some air to keep me warm.
Yes.
Happens automatically.
Yeah.
So with the limbs, it happens both sides. You don't have one side happening and not the other, do you?
Of course, yeah.
Unless it's abnormal, unless there's a problem. So basically, the brain knows that when you stimulate one side, so I stimulate one side with my acupuncture. This has developed over so many years, but I did use needles, and I knew that needles in certain areas would do this. So now I don't use needles, but I use laser acupuncture there.
Because you know the points.
I know the points, but I also know that the LED will do it as well.
Right.
So I'm doubling up in what I'm doing. I'm using two things. So basically, I can treat one side, but the brain doesn't distinguish sides. It just says, autonomic nervous system, fix up in the lower limb. Okay?
Yeah.
So basically, that's how you get the change. And these patients are often the most gobsmacked, if I can use that word.
Well, they'd probably be resistant too.
Well, they look and they say, I can't believe it. You haven't touched it.
Yeah.
But the colour's better.
Yeah.
The temperature's better. And the swelling's gone down. And this happens within 30 minutes, 40 minutes. Yeah. I mean, I can see it straight away. But for the patient to recognise it takes a little bit longer.
That's amazing.
It is amazing. That is amazing.
That's amazing.
But then these are difficult patients and it takes a while. I mean, a few treatments to get it down to a level. I used to, and how I saw this was that I used to give a lot of, I said I was doing interventional work during my transition from practicing theatre anaesthetist, operating theatre anaesthetist to pain management. And so that meant one of the interventions I used to do was what we call a sympathectomy, often lumbar sympathectomies. And that is putting needles through the back to these ganglia that control this autonomic nervous system, right? So you go in through the back, a few had to be done in theatre with dye, with image, anyway, anesthesia. So it's quite a rigmarole and an admission. But what we did this by putting local anaesthetic into this ganglia. It's like turning it off. And that's what I talk to patients about now. I'm actually doing a little force quit to this program that's out of whack. And when I think about it, we were putting local anaesthetic in this ganglia, turning it off for 6 hours, and the patients would be in recovery, go, oh, my foot feels warm again because I get cold feet or what. And they'd feel changes. So when I started seeing this back in 2000 and probably, I'm just trying to think, 2008 more, I saw changes when I was using these acupuncture points just like my sympathectomies. And that's when I knew what I was doing. That you were onto
something, yeah. I think it's amazing, and I think that, we have discussed that Australia is very reluctant to embrace, especially in the medical field, things that are not necessarily scientifically based. But the fact that you are a specialist anaesthetist and add-on or adjunct practitioner and use these treatments is incredibly phenomenal, because you have, you know, that scientific background as well.
And I wouldn't persevere in doing this if I didn't consistently see these changes. I think that's the thing that is a little bit upsetting for me from my colleagues, who sort of say, oh, are you still doing that, Euahna? I said, well, I consistently see changes. It's not just once in a blue moon. It is frequently. And my biomed students who work with me are the first to say, oh, we treat contralaterally in a lot of people, and we keep seeing the changes. So I teach them to look. You do need to have an observant eye to see this. And I think that was one of my advantages. My father had a photographic memory, pure. I don't have his pure photographic memory, but I do have a photographic memory of sorts. So I can see something, and that's why I said I noticed very quickly that there was a change.
Right.
Because it's like there's this print in my brain of how it looked, and then and I look, oh, it's different. Right? But I do have that.
The same.
I do have that ability.
That's amazing.
Yeah, because I do notice other people don't see it as quickly.
But obviously, just like you said, if you didn't see the efficacy and the benefits from the treatment, and patients going, what have you done?
I would be prescribing drugs like everyone else.
Exactly.
And I would be.
So what I'm hearing you say is that you have this kind of vision, this all-encompassing kind of vision of looking at an individual as a preventative rather than a cure with medication. You're looking at ways to prevent.
I'm looking at ways to reduce a pharmacological intervention that may be required.
Right.
So, and that's why I was saying to you before, anxiety and catastrophization, anxiety, all those, a heightened nervous system is very important it's a disadvantage in pre-op, because it will heighten the requirements of drugs post-op.
Right.
Immediately post-op. So basically what I aim to do is calm the nervous system down, dampen it. I had an anaesthetist, and she said, Euahna, the best way you can describe what you're doing to me is just say you're dampening the nervous system. Right. So this is from an anaesthetist. That's how she described it.
Right.
So I'm dampening the nervous system. So if we can dampen the nervous system prior to the assault of the surgery or injury, which is going to be, and we try to do that, by the way.
Yeah. And you
why
see
do you
surgery...
think people have spinals prior to various? Because we know the more we can stop the brain feeling that initial burst of pain, the less post-op pain. That's why we bring in epidurals and spinals when we can.
Yeah.
And what I'm saying is, if I can actually calm it down prior, so when there is a burst, it doesn't go to the stratosphere, it just goes up to here, that's helping.
Right.
And that's why we were talking about the old-fashioned pre-med that used to, patients used to be absolutely, not moribund, but they used to be really relaxed and calm when they came down to theatre, because we'd give them a very strong narcotic the night before, and they'd have a good sleep. Scopolamine was used as well, which is one of those sort of twilight drugs. And so they'd be really just wafting down, oh, am I having a hip replacement today? Oh. Rather than I'm having a hip replacement, So there's and we know that anything like that helps. We know putting the spinal in, so there isn't this huge surge of the cut.
Right.
And we know that. And I suppose what I'm saying is I'm just coming from a slightly different angle.
Totally different angle. Totally different. I mean, like I said before, that's how I ended up in your office. It was my gynecologist who we were discussing the options of menopause treatment, and she suggested HRT, and I said no, because Mum had died of breast cancer, and that's not going to be a very effective medication for me to take, and nor did I want to. I wasn't open to that. I wanted something
natural.
that was natural. And she suggested I come and see you. She said, go and see Dr. Euahna Varigos. She's an anaesthetist specialist, and she does adjunct or add-on treatment of laser acupuncture. And so, I mean, I was a little bit skeptical, especially when I saw that you weren't actually using needles. I was like, wow, what is this? And then you explained it's the light, and it works on your endocrine system, which regulates your hormones, and on and on. And after the third treatment, I was getting 0 hot flushes at night. My nervous system felt like it was so calmed, and I felt so much more grounded and centered. And yeah, I mean, you know, I'm definitely somebody that speaks highly of it because I've had the experience of it. And so I can understand that if someone's having surgery, that they would have that heightened sense of concern around being knocked out and having.
Everyone does.
In general,
Everyone does. To a certain extent. And even though people say, I had a patient here, oh no, I'm not anxious at all, but my blood pressure's high. Well, that tells you are anxious.
Exactly.
But you don't think you are. But everyone, you have to be. It's you know, when we anaesthetists, as anaesthetist, you know, when we are in theatre with you, we have to make you the prime. You know, it's important for us to make you feel that we are all there for you. You know, you are everything. Don't worry about anything else. We're here for you because you're in our hands.
I've had I've had probably 3 surgeries in my life, but one I had as a child, and I vividly recall, of course, as a child, you're concerned that your mother's not there, and you know, you always remember what's the most heightened emotional memory, right?
Yes.
That's what we remember. And I remember lying on the operating table, and I remember the dress that I had on. It had yellow flowers on it, and it tied up here. And I remember looking up and having all these faces look down on me. Yeah, right. And I'm a child. I'm probably 6, 5, and all I kept saying was, "I want my mummy. I want my mummy." And the nurse said to me, "Oh, what a beautiful dress. Mummy's going to be waiting for you after the surgery. Count backwards." And off I went, right? And the last surgery I had was with my gynecologist for the endometriosis, and it was kind of a similar experience, right? It was a man this time. Count backwards for me, and I'm out, and I'm out, right? And I mean that you're fraught with anxiety before the surgery. You know, this time I'm a mother, and I'm thinking, what if I die in surgery and I don't see my children again? And all these thoughts go through your head. So to have someone work on your nervous system in a way that helps you be more receptive to a quicker recovery,
and just to be calmer as you go in. And as I said, we now don't use the drugs that we used to use because they're respiratory depressants. So we try not to use those drugs now. And also because often patients are now having, not for total hips and everything, but people are having surgery and they're out that day. So we have, and that's a financial thing.
That's amazing.
It's financial.
The
hospitals want patients in and out quickly because they get a certain amount of money. I think, I don't know it exactly, but they get a certain amount of money for certain procedures. And I remember when I was doing a lot of foot, I still do a lot of foot surgery, but not as much pre-op now, but basically at that hospital. And they'd say 1 bunion, 1 night, 2 bunions, 2 nights. That's it.
Oh my goodness.
Yeah, bilateral bunions, 2 nights. That's all. Bilateral bunions. You're in hospital for 2 nights and then you're home. And even if you have your operation, and often you'd be last on the list, so the operation would be 6 or 7 o'clock at night.
Right.
That's your first night. 1 night, and then they're home.
Look, Euahna, I mean, let's just watch this space, because I think that there is movement in Australia, but it is slow and sometimes it is stagnant. I think that your work is phenomenal and you continue to do this amazing work, and people, you know, even the skeptics out there, give it a try. If you've tried pain medication and you're still in pain and you want an alternative, what have you got to lose, right? And I know for a fact, because I've had the treatment myself for my menopause symptoms, that it does work. And Dr. Varigos is explaining here that injuries and surgeries are more acute than menopause, where you're treating a whole system and hormones. So I know that it can work. I know that it does work. I'm Marie-Therese Bolden. Thank you, Euahna Varigos, for joining us again, and I can't wait to have you at my table and in my home again.
Thank you.